Welcome to Ortho Insider, the podcast that goes behind the scenes of orthopedic surgery in Canada and worldwide. Today we have a very special guest, Dr. Carrie Kollias. She works here at the University of British Columbia as a pediatric orthopedic surgeon, where she is a clinical associate professor. She serves as the co-director of Mentorship and Wellness in the University of British Columbia Department of Orthopaedics and is an investigator at BC Children's Hospital. Dr. Kollias specializes in pediatric orthopedics, limb deformity reconstruction, and surgeon well-being. She previously held the position of Deputy Director of Orthopedics at the Royal Children's Hospital in Melbourne, Australia. She is an advocate of physician wellness, and she has led national studies in Canada and Australia and is the author of an award-winning children's book called Maria's Marvelous Bones. Welcome, Carrie. Thank you so much for being here.
Thanks, Adrian.
So our first question to everybody is, how did you get into orthopedics?
Oh, okay. I wasn't expecting that one, but that's a good one. Well, actually, so I didn't have the best entry into orthopedics. I recently told this story actually last week fairly publicly, but I actually passed out during a knee aspiration when I was a medical student. And not only passed out, actually pissed my pants at the same time. Yes. So anyway, I went to school and told everyone on the Monday, and for my hockey jersey, because at University of Calgary we got nicknames that were put on the back of our hockey jersey, and the classmates would pay money to put it. So I got Syncope with an extra E on the back of my hockey jersey. So that's what I wore for 3 years playing rec hockey.
That is amazing.
Anyway, that was the start. Yeah. And I think that what happened with Dr. Jason Worley.
No way.
Yes. And I think he subsequently said it was his most memorable teaching experience.
No doubt.
But actually, in fairness, I had got the opportunity to go on elective to Angola the following summer. Worked with a Canadian general surgeon there, Dr. Steve Foster, with zero interest in orthopedics or surgery at that time, and then came back with a very, curious mindset about maybe I should pursue surgery, and then sort of started out with general surgery, shadowing, and then orthopedics, and sort of, I was hooked basically from quite early on. I didn't have the best entry into orthopedics, but soon I sort of fell head over heels for it, I suppose.
What changed in Angola from having zero interest to basically be a keener?
So I went thinking I enrolled in medical school thinking I would be a family physician or maybe a public health physician.
Cool.
Because I saw the benefits of like a system-based approach, and I strongly, was a fan of primary care. But I realized in Angola that I, first of all, wasn't very patient. And I liked working with my hands, which I already, I suppose, knew. Yeah. And I also liked the, I suppose, instant gratification. And I think that's something even more so in orthopedics that we get. I mean, you just you put up the x-ray, I'm like, look at this x-ray, like, look how awesome that looks. It's like instant gratification.
AFT.
Totally. So, yeah, right? So I think it was really that push. And I suppose I found my people. I mean, when you say, well, my people, who were those? I mean, most everyone I shadowed and was spending, evenings and weekends working with, like orthopedic residents, surgeons, they were all men.
Yeah.
Actually,
yeah.
Right? So you think, oh, well, is that my people?
Yeah.
Interestingly, I found actually culturally, it still worked. It still worked for me, right? I was able to find people to mentor me, to support me. They might not have been the same gender, but I have nothing but good things to say about that era. I mean, occasionally there would be a well-meaning person who would try to, talk you out of, why are you applying to orthopedics? Wouldn't it be better to pick something easier?
Yeah.
But those people were usually, number one, misinformed. Yeah. Giving their opinion based on anecdotal information rather than firsthand. So I had to, I suppose, learn that I had to shut out some voices.
Totally.
Yeah. So I think that's part of it, and figuring out who you can listen to. Do you respect these people? Do you admire them? Do they have your best interests, at heart? So yeah.
Absolutely, and that is a theme that we've heard over and over from all of our guests, and is basically, finding your community, finding the right people, no matter who they are, but essentially, are these going to be people who are going to support you along your journey? So that's a great segue introduction, an introduction to the things that you're doing in terms of surgeon wellness. You've done a ton of that when you're in Australia, and now we're so lucky to have you back doing that at UBC. So tell us about that.
So how did I get into that?
Yeah.
So it probably started back, I would say 2016. So I was working in Southern Alberta at the time, working regionally, doing peds and adults. And I ran for the medical regulator. So that's the College of Physicians of Alberta. So I ran for the board. I was quite young at that time, but I thought there needed to be some changes in terms of how medical regulation was done. Anyway, so I get elected to this board.
Cool.
I rock up. I'm like everyone's like 20 years older than me.
Yes, that's right. Yeah.
But I started becoming aware of, I would say, some more significant problems than I'd even realized.
Interesting.
And really, what kind of, and I knew that there were physicians who were really substantially negatively impacted by the way regulation was done. Medical regulation is absolutely necessary. It's required for, patient safety, for good care, right? But it was just sort of the method in which it was happening could be optimized. And around, I think, I want to say 2017 or maybe, 2017, I came across this article in the I think it was British Medical, it wasn't BMJ, but something similar. And talking about this anaesthetist a British anaesthetist who had taken a job in New Zealand and was moving his family there. He was like 10 years in practice, I think, by that point. And right before he was to move, like literally like days down, got served with a medical regulator complaint in the UK. And in the end, that was investigated. It was dismissed. It was unsubstantiated. There was nothing. And it took 5 months from start to finish for that to be, investigated and dismissed. And unfortunately, when they moved, this led to some spiraling mental health issues. They moved to down to New Zealand, and there were some problems, and he ended up ending his life by suicide. And his wife was a family physician, so that's Kate Harding was a family physician. So she wrote openly about this experience. And so I remember sitting on the board of the CPSA at that time, and I knew what our stats were in terms of like complaints processing times, and they weren't 5 months, let me tell you. And I saw, I'm like, look what happened to that guy in 5 months. Yeah. From something that was and I thought we need to do better. Yeah. So that was where I really, because I had this interest in medical regulation and then this well-being side, I was like, I felt like, I suppose, this urgency, right? At that time, we didn't have many numbers in terms of, we knew that burnout was sort of like a thing that was like out there. We just didn't have Canadian data. So in 2018, a group of us teamed up with the COA. Nice. To do that surgeon and train resident. There was a consultant and then resident burnout study looking at rates, right? So that was sort of, you just gave us some data. And I mean, I think it was something like 55% of respondent surgeons were burned out. Okay. And that was using the Mayo Physician Wellbeing Index, which is short, and so you have the attention span of orthopedic surgeons to actually complete it, unlike some of the more more standard longer tools. So that was that. Anyway, that was kind of how I got sucked into that, and the COA was very, very, very supportive of that work, especially in that, and that was 2018. And then I moved down to Australia. I had a great opportunity there, and approached the Australian Orthopaedic Association to do something similar. Now, we didn't think it was quite ready for the consultants. I see. There's a few more, I would say, cultural things in Australia that make it a little bit more tricky. And we were actually ready to roll that out, like literally the beginning of mid 2020. And you know what happened?
Yes, absolutely. Yes.
So then we delayed, we kind of delayed it a bit. And Australia was very heavily hit with a lot of with restrictions and COVID and a lot of border things. So yeah, we did eventually do that, but probably two years after we had originally planned, because we thought the data would be more meaningful. Yes. On that. So and those results were pretty shocking as well. So having seen, kind of worked in both systems and seen the impacts, I guess I've become a strong, very vocal advocate in terms of well-being and what does that mean from an operational standpoint in your institution, in your university, in your hospital, advocating for this to be considered as a criterion when decisions are made. What does that impact? And then here I am at UBC since I guess last year I joined, and then this position formally in January. So we're
amazing. We're very lucky to have you. You give these wonderful talks, about burnout, and you also you mentioned you held the role of the board member of this, CPSA in Alberta, but you also currently hold the board member of position of CPSBC, which is the College of Physicians and Surgeons of British Columbia.
Yes. So I was just elected. So I actually, to be clear, I think I start that position next month.
Got it.
So yes, I ran as a newcomer and
you made it.
Managed to squeak in the door. So,
no, it's amazing, but it speaks to your expertise. And, you recently spoke about burnout with respect to college complaints. And it seems like, at least in Canada, in our profession, it's one of those things that nobody talks about until it happens to you, and then you reach out to a colleague, and every single one of your colleagues has also been through it. Because I guess, correct me if I'm wrong, it is something that happens to essentially every orthopedic surgeon.
Almost, inevitably at some point, everyone will get. I think in previous eras, occasionally you'd come across a very, very senior surgeon who had never had one. That being said, the data is showing just like escalating complaints year over year.
Can you tell us, though, how does that affect basically the mental health and the well-being of that surgeon? You told a very, obviously, extreme story of a surgeon ending their own life. I hope that's not the usual.
Yeah. So the first part of that is in terms of the suicide aspect. Okay. Now, in Canada, because medical regulation is a provincial jurisdiction. Okay. So we don't have, like in Australia, they have APRA. In the UK, they have GMC, General Medical Council. So they have actually, all their data is pooled. So the GMC has data. The Australians have data. They know how many physicians under complaint have died from suicide or suspect, can they say, it's directly from the complaint? Well, no, you can never prove that. But we have data, from the UK, that if you get a medical regulator complaint, your chances of dying by suicide are 14 times higher than the average physician.
And the average physician already has a higher than a baseline suicide rate.
Higher than
That is wild.
So one of the challenges in Canada is we don't know. I've had I've personally had a colleague that has died in that way. So it's not like it doesn't happen in Canada. And I think one of the challenges is having it all these provincial kind of silos. It's an opportunity in some ways to hide or say, well, that's just a small number. We don't have a large sample size. You can't really attribute, X, Y, Z. It's a bit of a hidden issue in Canada. What we know is that people often will, not hide, but they'll often walk through it without telling people.
Yes.
Right. So you'll hear even, and you hear more, especially stories in the United States, for instance, where lawsuits, for instance, different stress, but are, which is more common. And these reports of for instance, surgeons, literally not even telling their spouse that they're being sued until it goes to public court, that kind of, isolation. And so when people are, there's a shame associated with it. And when people think because people come out and they think okay, that's never happened to anyone, I'm a bad doctor, what's wrong with me? When you actually look at the data and the escalating numbers, it's very, very common.
Yeah.
So part of, I suppose, my interest in well-being and the medical regulation side is to I suppose publicize potentially how common it is. There's lots of talks from CMP about how to stay, not get a regular complaint. Okay. And it is very important. There's strategies to avoid, right?
Yes.
But sometimes things are out of your control and you do everything right and it still happens. And I suppose having people recognize that they don't have to walk through that alone, right? That doesn't mean you go out and share all the intricate details of the clinical aspects of a certain case. Yes. But Usually that's advised against by, for instance, CMPA, but no one can block you from, talking to a colleague about what it feels like.
Yeah, right.
What you're personally, the stress you're personally experiencing.
Right.
And so I'm really trying to champion this so people talk about this,
Yes.
and which is, I think, exemplified in some of the other, topics we've had. I mean, Alistair Younger spoke recently,
Yes.
right? We're trying to just get this out there so
Absolutely.
people don't feel like they're all alone.
And so how do you change that mindset to have something that was so kind of in the shadows and so taboo to speak about, to bring it to something that can be discussed openly without that shame factor?
Yeah. So I think people that are well respected bringing this out, right? Because sometimes people say, well, I can't, they feel like I'm too junior or I can't talk about it, or they don't. But when you have, I think there is an onus on surgeons in the field that are extremely well respected, right? Where there's not this question of, how competent or whatnot. When they get up and they say, listen, here's my rap sheet, right? It normalizes it.
Right.
Yeah.
Yeah.
So I think those of us who are a bit more senior and had maybe a little bit more experience under our belt, like, it's important for us to talk about and not expect, the people in their first 5 years of practice to be the ones championing this. We need to, the more senior people need to take a lead on it.
Totally.
Yeah.
And so you've also done a lot of work in like kind of mentorship as well. And so do you think that kind of leads into a little bit of that resiliency that we can also help build on the other side of it as well, or are they totally separate topics?
No, I think there are. I mean, well, there's mentorship in general, but I mean, when people, like, for instance, when I was on the College of Physicians, or like in the board, that was, you could say, well, was that a mentor-mentee relationship? I'm like, I mean, come to think of it, kind of it was, I suppose, because I knew the details of the process and, giving advice, like, okay, if you're going to do that, you should do that first, kind of thing. So I do think there's a role for that. And certainly with our UBC program, when we've talked and talked openly about, medical regulator complaints multiple times now in the last 6 months, there's been surgeons who have reached out and said, I'm struggling or I'm having this issue specifically. Can somebody help me? Right. Yeah. And so I think that's powerful, is just to put it out there and then make it okay for people to say, absolutely, I want help. Yeah. Why would anyone who's 30 years in practice, who suffered through that maybe in solo. Yeah. Right. Back to the point with how my early days with this. So in 2019, COA meeting, right? I don't know where that was. Quebec, maybe? I want to say Quebec. So we had this symposium, this well-being symposium. Yeah. And we presented our findings from the big survey that I had led. Yeah. And I asked, there's a room of about 160 people. Yeah. And there were there's 4 of us that were kind of moderating or giving our inputs and things. Yeah. And I said, okay, so of this room, and there were a lot of surgeons, not as many trainees necessarily in that area. I said, in this room, how many of you as a trainee had an attending surgeon tell you what it was like to get a medical regulator complaint? Okay. Mm-hmm. And out of a room of 160 people, I think I saw 5 hands go up. Wow. And so I was like, we know this is so common. Yeah. We even knew at that point, and the data now is the last 5 years, it's just gone crazy, right? Yeah. I think actually orthopedics is sort of, it went up and then it sort of has settled a little bit. But that was the first time I can recall that being talked about in sort of a public or orthopedic sphere. Yeah. And now we're talking about it all the time. That's right? Amazing. So, at least in our program, and I hope in other programs as well, that becomes more, out there, open discussion.
Why do you think the complaints are going up so much?
There's some theories about that. Yeah. I think, again, this is my personal view, is some of the failings in the overall system in Canada, especially the long wait times. Yes. Those specifically apply and affect orthopedics. So if you waited 2 years thinking that you're going to get an answer to your pain and suffering, and then actually you get seen and the options aren't as great as you thought. Everything just is amplified by time. Yes. Yes. So I think that's a hard thing for us in orthopedics, is to really be able to still show empathy but understand we can't like solve every problem.
Totally. And expectation management, I guess.
Yeah. And I think the other thing is probably, in Canada at least, there's not that many other avenues to kind of pursue justice or whatever, what people perceive to be justice. So, so it is an avenue for patients, I suppose.
Yeah.
It's a challenge.
So you mentioned earlier too some strategies in terms of mitigating the risk of a regulatory complaint. Like, what are some of those things that everyone can do?
Okay, well, things to do to mitigate regulatory complaint. So number one, make sure you're working in your sphere of competence, right? And so to maintain a level of competence over time. So it's possible that like early career, you're fully competent to do something, but as time goes on, then maybe you have a bit more of a focus in one area. You may want to let some things go. So that is one thing. I think that's a natural evolution that can happen. I think being very careful about who you hire for a medical office assistant. So your frontline admin are like absolutely key. And, sometimes depending on people's practice setting, people like surgeons will have more control or autonomy over that than others. Yeah. But I think, if you're fresh out of practice and you're trying to decide who you're going to hire as your medical office assistant, that is like second to deciding who you're going to spend the rest of your life with as a life partner. I think that is probably the most important decision. And people, that's not widely publicized. Yeah. So that is key. And I think having that person where they're competent, they're responsive, but they also have empathy.
Yes.
Right? Yes. Because it's that being able to show empathy. And I don't mean in a fake way. I mean actually like being able to understand people where they're at.
Absolutely.
And I think that goes for us as surgeons as well. And like being able to like put ourselves in the patient's place and understand what their interests are. What, they're coming with this, but what are the real interests? Like what do they want? And so sometimes like even like for instance, something that I do now or the last several years that I didn't start out doing, at least mindfully, was, let's say I had like a consult, right? And you could tell that what you were telling them was sort of different than they expected, right? So like now I'll actually formally like ask them, I'm like, how are you feeling? Like, is this like, did you think there was a different, going to be different expectations for the day or different outcome? Or or maybe they're looking like confused or they're looking anxious or, and asking like, how are you feeling? And I find like patients and families like get stuff off their chest way earlier, right? Yeah. It gives them an opportunity to say like, this is what they're really thinking, especially when there's like there is a power differential between the physician and the patient, and being able to communicate that early, how they're feeling and get that off their chest. I think it eliminates so many problems down the line if all that is like accumulating and built up. And also practicing in a group, right? Like it's 2025. If there's a case that is, unusual, it's controversial, like, get input from your colleagues and maintaining, strong working relationships with your colleagues. Yeah. That is like the crucial part of, I think, avoiding both medical regulatory complaint and burnout.
Yeah.
So they go hand in hand.
Yeah, absolutely. Yeah. So let's switch gears and talk about a burnout a little bit too. Yeah. And you quoted a very high, like I think it was over 50% burnout rate among people who surveyed. And, one of our other guests, Dr. Len Murray, he did a similar study in South Africa. And it was like 70-something percent. It was wild. So, what are some factors that are contributing to this and how do we mitigate those?
The clinical load, right? Which is a huge factor in Canada. I think the community part, like there's factors that we can control. Mm-hmm. We work in Canada, or other listeners are working in other places, very challenged, public healthcare systems, right? There's factors that you can control, right? There's factors that you can't control. Yeah. Now, there's some factors that are in between. You think, well, I can't control, but actually, if you push or you advocate, then there are things that you can change, right?
Yes, sure.
But for me, community, which is like community, what's community? That sounds like, is this orthopedics? What are we talking about here? But literally that is the most powerful thing at our disposal to keep us all healthy, right? And live in community. And I think COVID in some ways has given us more permission to talk about this because of the isolation, I suppose, that people experienced, and they could see firsthand the impacts on their mental health, their well-being. And so I think people became almost mindful or aware that, oh, actually, me being by myself in isolation is bad for my brain, right? Yes. And so that COVID has offered a lot of opportunity for us to really open that up.
Yeah,
yeah,
absolutely.
Yeah.
And through different avenues. So, when you say community, it doesn't necessarily have to be that, classic community of like in person, let's get together kind of thing. I mean, there's also, I am very biased, but there's things like online communities and forums you can join also, right?
So, I mean, like for instance, face-to-face still always the best, right?
Totally.
But I mean, like right now, for instance, for UBC Orthopaedics, we've got this early career surgeons WhatsApp group going, right? And so and it's brand new, you've got surgeons in their first 3 years of practice. They're geographically distributed all around British Columbia. Relative isolation in terms of age, because oftentimes if there's, say, 4 surgeons in a center, 3 of them are over 50, and then, right? So it's to try to link all those people together.
It's a great idea.
Right. So, I mean, it's something, right? It's not everything, and you hope that will actually blossom into more fulsome, relationships and community. But it can take many different forms, and I think there's more opportunity there than classic models, especially when people are living geographically dispersed.
Yeah. No, that's amazing. We always kind of hear that there's different expectations from the next generation of doctors. Do you think in your role as kind of mentorship and wellness and surgeon well-being, is that just something that every generation says about the next generation, or is there some kind of a shift happening because of all these factors that you've kind of spoken about?
I think there are generational differences. And I don't mean it's necessarily the same in every generation. We know that depending on what generation you have different values that you prioritize, right? And so this younger generation, right, which if they say they're in their 20s, they actually highly value relationships. They highly value community. So, when when we were doing the engagement sessions for our mentorship program, saying, okay, you go to the mentors, what do you want this to look like? We went to the mentees, what do you want this to look like? And so, I rock up to the resident session, and there was we had a professional coach to help facilitate it, right? And it kind of came up in the discussion about how they really felt they wanted community. They wanted to know, and not just people in their age group. They wanted to hang out with us.
Interesting.
Right? So I literally was like, so guys, from what I'm hearing, like if there was a mentor and they were like, oh, do you want to come over for dinner, with my family? Would you guys actually want to do that? And they're like, oh yeah.
Really?
Yes. Which I was like, I didn't say I almost fell off my chair, but I was kind of like, that would not have been a top desire of mine when I was a trainee. Keep in mind, that's like 20 years ago, right? So I do think there's a shift. Yeah.
And then, so on the flip side, though, then are the mentors who maybe don't have those values, were they willing to do that?
Yeah. So, I mean, that was one of the questions we asked in the intake. They're like, what are the forms that you would consider, meeting, right? So, that was one of the that we listed, right? Because we're trying to we're coachable too. Like I'm mid-career, but like old surgeons, they want to help.
Yes.
Right.
Yes.
And so they say, well, if we say, well, actually, these young, these residents, they want to come to your house for dinner. They're like, oh, okay. Yeah, I can do that.
Yeah.
They just need some coaching.
Yeah.
So, and that's our job to just to help facilitate that.
So, okay, this is a very interesting topic now because we are in a very significant generational gap, it seems like. And, we're on the RPC and the residency program committees and trying to find ways to, connect with the trainees. So can you share with us some other things that the trainees were kind of yearning for?
I think some of them, they wanted a listening ear when things weren't going well. That was very clear. A lot wanted, some help with like career direction and things. Those would be more, I would suppose, more mid-resident or later. And yeah, like I wouldn't say like the financial mentoring was like a big desire, especially early career.
Sure.
There was a strong desire almost universally for assistance in work-life integration, work-life balance.
Yes.
Yeah, how to navigate that. Like if if you're a male, if you feel like, no matter whatever gender or whatever stage, like that was across the board.
Yeah.
There was I would say, a lot of young people valued family.
Yeah.
These things are important
Yeah.
for this generation.
Oh, amazing.
So, I mean, I'm encouraged because I feel like it's sort of blowing open, these things that we just didn't talk about or give necessarily value to 15 years ago. And now it's like, yeah, we're there. Like,
yeah, absolutely.
Yeah.
I mean, that's so important because, if there's this, it kind of goes exactly to your point that you've been talking about. The overarching theme is like community and communication, right? Just being open and being upfront, like you said, with your patients, you're asking them, what are your expectations now, right? It's the same kind of idea. Yeah.
Yeah. And encouraging that open dialogue. Like,
absolutely.
Okay, and one of the things was, with this intake when we're matching, because we matched people, we actually went through a process to like, okay, what are your values? What are values? What do you want out of this relationship? And we tried to really we took a lot of attention to try to match them. Not everything will be perfect, right? But trying to like encourage people to be upfront about what they needed, right? Because that's one thing that I think younger surgeons and trainees, like the mentees, we're trying to coach them too and say like, your mentor hasn't done this before. Right. Like, we're learning too. This isn't going to be perfect, and trying to like encourage them to be upfront about what they need.
Yes,
because oftentimes we don't necessarily have in orthopedics necessarily a historic culture of just like, as the younger, on the learning side, just being able to say what we need.
Absolutely.
Yeah, that's not been part of our culture.
Yes. Has that been a culture shock for the older surgeons? Because again, they came up in a totally different environment, right? And having these young people say, I do need this, and dictating things.
I think a little bit, but not in a negative sense.
Yeah.
They're like, I guess there's a bit of a selection bias. I mean, the fact like these mentors are like, they want to give, like when you say, well, why do you want to do this? They want to pay it forward. They're like, I want the next generation to have an easier time than I had. Like, that's very clear.
Yeah.
So yeah, I think it's we're figuring it out as we go, right?
So, and one of the things you touch upon too is like, people are craving that work-life balance and work-life integration, I guess, and we've heard a lot about from other guests about pursuing your passions. So on that note, who is Maria?
Oh,
and what are their marvelous bones?
Okay, so Maria's my daughter. Yeah. This was a children's book that I wrote in 2018. 2018. Yeah. It's about a kid who breaks their bones, falls off the couch under dad's watch and gets taken to the hospital and then gets seen by this, at that time it was actually very ethnically diverse and gender, there was a male nurse and a female orthopedist. Right. So, all these, and it was sort of subtle into the, the book. Yeah. And then goes through the process of, cast and reduction and cast and healing, all this. So Maria was my daughter, so I named it after her.
Nice.
Yeah. Yeah. So and my son's in the book too.
Yeah.
Yeah.
And, you kind of mentioned that you've always wanted to write that book, and has that always been a kind of creative outlet of yours, or is it a bit of a one-off thing?
I had thought about writing it 10 years prior when I was a resident.
Yeah.
But I always say, residency training doesn't necessarily facilitate creativity. Yes. I always say, we often will admit people to medical school, the most amazing, creative people. Yeah. And then we, it's necessity in some ways. We sort of push them through this, tube. Yeah. Which is sort of part of the training process, I suppose, and the enculturation, which, there's a certain amount of that is required, right? And then I always say, well, it took me probably about, 7 years in practice before I started getting my creativity back. Yeah. So, and now I'm just I'm trying all kinds of stuff. So I have no more kids books on the direct horizon. But yeah.
Oh, that's amazing. Yeah. And so what would you say to anybody who's trying to rekindle a little bit of that passion?
Yeah, I think carving off time, right? It's interesting. When I was working down in Australia, we had this it was full time. But the days were really long. Like the ORs don't finish there till 6 o'clock, for instance.
Oh, I see.
So interestingly enough, my roster, I didn't actually work most Fridays. So I was like, okay, well, I'm going to do something for me, right? So I went and decided I'm going to go learn pottery, or you just think. So I think actually carving off the time kind of intentionally is very good. Yeah. Yeah, because the work will just keep going and going.
Absolutely. Yeah. There's always going to be work.
Yeah, and in Canada now, you're seeing more practice sharing kind of arrangements where people are like, no, I'm, 4 weeks on, 2 weeks off, or they have different arrangements. So I think there's more opportunity for that to have people, find their creativity back and then also not burn out.
Amazing. Yeah. So important, right? Yeah.
Yeah.
Well, that's perfect because again, with Dr. Sufti Delai coming up, this is a huge kind of platform of hers. So I think the timing is perfect. So if anybody wants to find out more about, mentorship and wellness, surgeon wellness, you through yourself with the COA or even regulator complaints,
Yeah.
how can they do that?
They can contact us at UBC Orthopaedics, right? Absolutely. I'm on LinkedIn. That's my main kind of the platform that I use these days. A little bit of Twitter, but not or X, but not too much.
Yeah.
Or more LinkedIn. So
Amazing.
yeah, happy to. I take random phone calls from people, and yeah, it's interesting when you kind of put yourself out there as to try to help people. It's I suppose scary in some ways what you hear back, but also a real privilege. So,
yeah, amazing.
Yeah.
Well, thank you so much for all the work
Okay.
you're doing. We love that you're here. We're very lucky to have you
Thank you.
back at UBC. So thanks again for the chat. That's amazing.